There you go. Well, good evening, everyone. Welcome to the Dunn County Health and Human Services Board for July 27th, 2023. First order of business is the call of the roll. We are missing Supervisor Steen, but Supervisor Breslin, Ms. Rudy, Supervisor Hagan, Dr. Hall, Mr. Lamb, and I are all present. Meeting minutes for 6/22/2023, trying to remember this time. I'll need a motion to approve those minutes. Supervisor Hagan, is there a second? Second. Thank you, Ms. Rudy. Any additions or corrections to the minutes? Additions or corrections? If not, all in favor of approving the minutes, say aye.
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 Any opposed? All right, the minutes are approved. And I understand that we have, I'm sorry. Supervisor Hagan moved, Ms. Rudy seconded. Yeah, thank you. I understand that we have public comment that came via email.
So
Ms. Winter, go ahead,
Thank you.
please.
there was two public comments, but they are the identical email, 1 minute apart. And so I'm only going to read one, but they're identical.
Okay,
Okay.
just make sure that the names are mentioned.
Yes, this one is from Jeremiah's Bullfrog Fish Farm. And it was sent yesterday at 6:14 p.m. and then 6:15 p.m. It says, "Thank you for allowing your citizens to add public comments to the board meetings, even if we're not able to attend. I am commenting regarding the enormous increase in licensing fees over the last few years. My husband Jeremiah Frederickson and I purchased Eat My Fish, the Rainbow Trout Farm south of town in 2017. We had a bit of a shock as we jumped into business with all of the licensing and regulations we were required to carry. But with serving a food product to the public, it's understandable. However, in the past 2 years, our licensing fees have increased dramatically. Our mobile retail alone doubled 2 years ago as Dunn County took over licensing from the state. Then this year, we were told we instead needed a transient food license, which increased our fees another $85. Over the course of 2 years, that license alone is over a 200% increase, $65 to $195. Our restaurant license has also increased due to the restructuring of the complexity of serving fish. That increase was a 35% increase over 2 years, $460 in 2019, $535 in 2021, $620 in 2022 and 23. These astronomical increases in just a short time make it hard for small businesses like us to continue to offer our products to the community. I would like to request that Dunn County review their fee structure to at least lower the cost for farmers selling their prepackaged foods to make it more affordable to the farmers and therefore more accessible to the community. Thank you and eat my fish. Jeremiah, Jordan, and the farm crew."
Thank you. And this,
There was another one.
I have another one.
Oh, okay. Oh,
Yep. So there was 3,
There-
but 2 of them are identical. Yep. And then the third one is from Katie Valley Pasture Farm. And it says, "To whom it may be concerned, I would like to submit this comment for the full board meeting on July 26th and the Health and Human Services Committee meeting on July 27th regarding the fees being charged by Dunn County for licensing for farmers to sell prepackaged meats, eggs, and dairy products at farmers markets. There are multiple vendors at the Menominee Farmers Market that have been selling meats, eggs, and dairy products for multiple years at the Menominee Farmers Market. Prior to 2022, if we were selling in multiple counties, we needed to be licensed through DADCAP, and that fee was $65. I was told by DADCAP that in 2022, Dunn County became a contractor for the state, and at that point, set the fees for the licensing. In 2022, I was issued the same license as I had been with the state, but through Dunn County, the fee was $105 instead of $65. In 2023, I was again issued that same license for $110. But after the license was issued, I received a phone call indicating that I needed a different license due to a mistake that wasn't caught by the county when reissuing, and the fee would increase to $197. The fee increases for selling at our local farmers market for producers that were licensed prior to 2021 has increased over 200% for multiple vendors. All the meat and dairy producers selling at the farmers market also have an additional license for sales from our farms. The fees Dunn County charges to sell at the market have prevented and discouraged new vendors from selling their eggs and meats at the farmers market. I strongly feel that Dunn County should be encouraging local farmers to sell the foods they are producing at local markets and fairs and not hindering them with fees. Comparable license fees are $60 in Chippewa County and $66.50 in St. Croix County. The environmental health staff person I spoke with in St. Croix County also shared that she has received a phone call from a Dunn County staff member asking if St. Croix would issue a license for one of the meal vendors from Minnesota that sells at the Menominee Farmers Market because of the high fees. It is also frustrating because the big box meat vendors that set up under tents in mall parking lots are still licensed by DADCAP for a fee of $65. This information was shared with me directly from DADCAP. I would like to request that Dunn County review their fee structures to lower the cost for farmers selling their prepackaged foods and eggs at the farmers market at ASAP to make it more affordable to our local farmers. I would also like to request that the fee changes from 110 to 195 be waived for the producers that were affected by this change in 2023 due to the error by the county. I have been in contact with Amy Arbeton with the Dunn County Health Department, but was told that if I wanted to stay with the $110 fee I had already paid, I would need to change my farmer's market setup to include a mobile cart and pay an additional $55 plan review fee. I do not feel that this is an acceptable solution to resolve their mistake with multiple vendors. In the future, I would expect fee increases to be shared in advance of licensing and in writing, like the 2.5% increase that was shared with us in January and not via phone call after I had already had a license in hand. Thank you, Katie Bear.
Thank you, and thanks for those comments. This is not an item that's on the agenda. I'll remind the committee that we approved an ordinance affecting these fees and the fee structure, and have a plan to review the fees in January. We do have a document here that KT may address on this issue in her report. All right, moving on. Next meeting date is August 24th. Again, that's a regular meeting date. We will be having a public hearing at that time to review our CDBG grant, which this is second required public meeting on the grant that supported the housing study. So that's the work on that is already underway. So just be cognizant of the fact that there is a public hearing at that time. Any concerns about that meeting date or Supervisor Hagan?
Do we know if that day is anyone's birthday?
I really don't know. Please feel free to
It's the
disclose
day
your birthday.
after mine.
Okay.
It's the day after mine too.
Well,
Oh
I
my
guess it's,
Well, we'll have to have a treat then.
well, I guess it will be cakes, one for Paula and one for everybody. Okay. Nothing from me. So we're moving on to Veteran Services. Greg, are you ready?
I am. Good evening, everyone. I will start off with the memo formatted document that identifies different categories of local, state, federal benefits. And I'll just kind of give you a quick overview for local or local activities. Just to highlight, we received a couple referrals from law enforcement over the past reporting period, and basically just provide a little bit of information around the context of each of them. And I just highlight the law enforcement. They have a couple behavioral health officers that did some outreach actually with us a few months ago. We've had other referrals, I would say in the past, or we'll say highlights of some individuals that they've been in contact with. And so it was good to get a little bit of information ahead of time, and it was just more of them. Honestly, they were really looking out for a veteran in a we call it a substandard housing situation. That there was a lot of police contact and activity around the house, and so they were just kind of looking out as he had identified that he had served in the military, to see if there was some things that we could do. So we've engaged with that, thankfully, with the additional part-time person, and it's kind of a task that I've put on her to really look at some other housing options, as well as some funding resources, and also there's some local programs in human services that are involved with this individual as well. So it's again touching many parts of the county,
Yeah.
one individual, but again, the higher cost burden is if they're incarcerated. So
Sure.
trying to ensure that doesn't happen. The other referral, just a tough situation, some road construction activity and some boundary related and untidiness stuff, and the individual is just giving some feedback loudly, and that ended up in police contact and triggered additional symptoms. But the individual was all over their own situation, to knowing what they needed to do, what they need to put in place to resolve that. And so all that stuff's in motion, and made contact, future plans. And sometimes a lot of these situations, just giving an individual a little bit of time to listen and to let them work through what their plan is. And that really identifies where the holes are in the support. So that's kind of going on with that. And so again, we got multiple departments that are touching the individuals' lives, and again, trying to save some additional money down the road for these individuals. On the state benefits, I'd identified that there's a meeting today, which I tried to not go to, but I just got back from Madison, so I drove down for a meeting down there, which is valuable, just to represent as part of our association's leadership. It was with the newly appointed. They still have I think it's the interim secretary of the Department of Veterans Affairs. So it was with them, then all of the bureau staff that gave highlights on their programs. So really identifying what are the priorities, and then really how service organizations, which the county veteran service officers are an organization along with VFW, Disabled American Vets, and American Legion. So they're all part of that great brand new building down there. I haven't ever been in the new, it's the Department of Administration building. I was trying to go by the Capitol, because I remember years ago when I go down there for meetings, it was a different location, but made it there on time. And really the part of their reasoning to try to bring people to the table. So it's about relationship building, and more individuals at the table, more organizations, to really kind of define how can we make things better. And so I was impressed by that, and pretty optimistic about the future. But so much comes down to money. But if you at least have those relationships formed, and know that you have each other there to help support and advocate for, really to maintain funding, and then when opportunities present themselves, be prepared in your planning process to request additional funds. So I'll continue to report as part of the leadership with the association on some of those, because the state has priorities. Every organization has priorities, and just how we can all nest together. On the federal benefits side, just to emphasize, so last month I reported we had scheduled continuing education training with our national conference. Here to report completed. So that piece is done. And then I'll just highlight a VA program. You know, a lot of good things happen in organizations. There is a challenging program with the VA did a caregiver program expansion a few years ago, and it has received some, I would say, national attention. In our area, it's all designed locally. The hospital has the decision-making ability. They're the ones who have the veterans' medical records when their individuals are making a determination based upon activities of daily living and the support. Because it's less costly to have a caregiver assist somebody to remain in their home than it is to send them to that higher level care and any type of assisted living up to where they need more medical care. However, the approval rate is horrible. No good way to spin that. About probably 10 applications since the expansion, only one's been approved. The veteran died that month. So that kind of, to me, as I assess that, I'm like, okay, so is that the criteria for the assessment level of the need, or was that just an isolated incident? But I haven't had any other approved yet. And I've sent colored photos of bleeding veterans to based upon them trying to handle things at home, which they shouldn't, when their caregiver has to actually go to work and then come back. And so there's safety concerns, but so much comes down to what's embedded in those health records for the determination. And then when they conduct virtual assessments to make that final determination. And some of the veterans we're working with are like, no, I'm good. Strong, fit, handle my business. And the caregiver is like, oh no, house is on fire and I come home and stuff. So there's a little bit of prepping to say, no, if you're burning your house down and you can't get out of bed by yourself and you can't shower by yourself, probably not as good as you used to be. So those are some things we're working through. So again, it could, my assessment might be a little premature that the program criteria is too strict, but it could be that maybe individuals are not identifying all of what they need help with.
Sure.
So I'm just kind of keeping an eye on that. And it is a tough thing to help advocate when everything is no, but we're the face and the ones that answer the phone. So individuals are a little frustrated, like, hey, I don't want to come home to something bad, but I have to keep the lights on. And what the caregiver program offers a payment, offers health insurance, because again, that cost is less expensive than going off into some type of skilled nursing.
So Greg, we have 10 veterans that are waiting for approval on that? Or-
No, those are denials. I've got two applications, one application in right now, and one is on its way.
Okay.
The individual is still hospitalized, so he's not ready to return home yet. And that one I've got an appeal with the Board of Veterans Appeals, but those take 2 to 3 years. And so we're not going to need the caregiver program by the time I get the appeal. So you just pop in a brand new application identifying new material evidence. Things have worsened and I've made direct contact with the caregiver coordinator. Good conversation, patient advocates, good conversations about it. And so we'll see where that leads. But I haven't seen the success. I've talked to some of my cohorts. And they're like, yeah, I think we've had some success, but that doesn't mean that they were approved. It could just mean that the veterans hadn't circled back to provide updates. But I just think that's the way forward, I believe, with reducing some costs rather than paying for skilled nursing home. And people, if they have the ability to stay at home, they want to stay at home. And we want to make sure that we're as proficient as we can to help assist with that process. One thing I'm going to circle back, Supervisor Hagan contacted me about a self-identified veteran homeless and needing food and stuff that is at a public location. And just to kind of further elaborate on that, those situations are visible at times. If it's a veteran in Dunn County that is identifying that they're a veteran in need, my request is, hey, just roll on the window down and say, hey, we got an office, give them a call, they got you covered. And sometimes those individuals already know that. And they're sometimes in situations where they're choosing to not access the services that are there that can take them outside of that culture that they're used to living within and function in. And so, but the best thing that can happen, because there's resources available. If everything is available and accessible to support and improve that service, that's as anyone in the county, that's what I'd ask. And then if we fail, then that's when we need to hear that. But because if somebody's out requesting some additional help and support, because a lot of services don't come in the form of cash.
Right.
And so sometimes those are the pieces that individuals are looking for, because you have, then if you're getting additional support in cash, then you have the ability to buy some of the things that are outside of food share, outside of gas cards, outside of Goodwill vouchers, outside of your rent and utilities. Because all those are contractual basis, no cash leaves the county, only direct vendor payments. So that's what if anybody in the county, if we're trying to help and support and advocate, that would send them to the entity that is supposed to do that work. If that entity, our office, is failing at that, then we need to know that, and others need to know that. Okay.
Okay.
So any questions about that? Then I can move to the Veterans Served report. And again, I put in the 2022 numbers just so you can have a visual and the ability to compare and look back, and we can also talk trends and patterns. And just the bottom one, line 14 that identifies retroactive payments. We've got 1 year historical. So really there's you can compare month patterns, but right now that there is no trend in just until we get a little bit more data to look at things. Identifying an impact statement to veterans impact, just so you have a good understanding of some of the I'll look at it as savings in the form of veterans receiving payment. Had to do some a little bit more work and for a veteran hasn't worked in a few years. I think it's congestive heart failure, cardiac artery disease, number of physical issues, attempted retraining to school, not successful. But a significant utility bill, very, very significant. And I inquired into, like, how does it get to be that? Like, I've been in this work environment helping folks for a long time. When you hit $20,000 and above, how did that happen? And it's because of medical device. There was a period of time, medical device, they can't shut it off. And so that's all caught up. But timing could not have been more perfect in finally working through the claims process. And again, because the cardiac artery disease identified that, that was caused by hypertension, nothing else, but sleep apnea causes hypertension. So we just did an end around and got it done. Back pay, utility companies happy, lights on, no money heading out to have to remedy that. But in credit to the veteran, he already worked out a repayment plan and just very resilient on that. But we're trying to work through other avenues to kind of help out with that. And sometimes when things are tough, nobody wants to open the mail, so it just compounds. And so the second one, Vietnam veterans skeptical of any government organization at all, just very pessimistic. So we got trust building, we've got many denied claims, and honestly unfairly denied, just like his criticism of past stuff is valid. And a lot of times I typically will not validate that stuff. I mean, we just got to rework it. But when it back our older veteran service members, they did not do good in processing physicals or exit physicals. And he is a Vietnam veteran, never did an exit audiology exam. And he had in his service treatment records, we dive deep into those, said he had hearing loss in there, objective hearing loss. They denied it, said that he had an ear infection when he was an infant, and that was the cause of it. So you have to finesse things, because it was all at the time, because that was in 1970. Then I did it again in like 80. I tackled it again like in early when I started here. But in the end, you get the right journal articles, do the right process. We got it done. And it very pleased with that. It isn't a significant, the percentage very minimal. However, it's the validation that finally they all the objective evidence there, they looked at it, then that may mean that the Veterans Administration and how they're training their staff, they're looking at things more thoroughly. So, and we've got him and I've got a little bit more work to do ahead of us as well. But that was, I think, an important win, and a lot of these situations resolve positively because of improvements within technology and within the Veterans Administration, allowing access to service officers and veteran specialists that work on this stuff, so we can see what they see, and we can look at the examiners, how thorough their exam is. We can see the service treatment records. And years past, it would be 6 to 8 months to get a paper box. I mean, a big file to be able to dig through. And so a lot of that has assisted, and Control F to go and search documents has been a good feature. So just kind of a little bit behind the curtain on how things get to this point where I'm reporting on a positive outcome. Any questions about impact statement, any of the numbers that are produced on that?
Any questions for Greg?
Okay. I'll move to the next. I included a document. Actually, it came from some past partnership with UW Extension. We worked with them on a training over the past couple of years. And anyway, that one of their staff sent me this Alice report, which like, oh, cool, this Alice report. I don't know what this is, but it has a whole lot of stuff in here about veterans. So then I kind of dug in a little bit to look at, okay, what's the takeaway? Why is this significant? Or is this just a forward, here's something that says veterans. And actually it was, in looking at it again, I can't claim to have went through with the fine tooth comb, but hitting the key points of this document. My takeaway on this is that our serving in the military benefits you, as reported in this document with objective evidence that veterans are employed at a better rate than non-veterans. And as well as there's some other few concerning things, but veterans that are disabled compared to non-veterans that are disabled are employed at a higher rate. So there's some of those factors that what's the reasoning, the etiology, I don't know, but to me, my takeaway is that you have a group of individuals that have some skills that can be utilized and that do have a little bit more resiliency. And those of us in the helping professions, I think, can capitalize on that to encourage, like, hey, you've worked through tougher situations. You've got the strength the intestinal fortitude to work through this. Let's get you in the right direction. That's kind of my takeaway. But in looking at the ALICE threshold income on page 2, if you look under the key terms, that helps define what the ALICE income threshold are compared to the federal poverty level.
Right.
And I'm sure there's some people around the table that have a little bit more knowledge about
Kinda
some
know
of
what
this
the-
than me. Yeah, so this is brand new to me, but it's objective information. And I think that identify housing as well. So there on the labor force side, I kind of indicated that using the demographic 17 to 64 on page 6, that 48% of veterans with disabilities 17 to 64, age 17 to 64, were out of the labor force compared to veterans without 14% without disabilities, but that is much lower than those that in compared to the non-veteran status. And there was a housing area that I thought was also interesting on the home ownership,
Mhm.
that there's higher
Quite a bit higher.
yeah, higher home ownership or owner occupied for veterans, and they attribute it to the lending, VA mortgage.
VA
Yeah,
lending.
yeah, and the benefit of VA mortgage is you don't have to have 20% down equity, but again, it doesn't matter how much money you're throwing down if you don't have the debt to income ratio that the bank wants, as well as the credit score. But there's a little bit more flexibility if you serve because of the backing, the VA, like the security that they put behind that. So I just provided that to you. There's a couple of my takeaways in the document. I'm sure that I'll see some more, and kind of triggered me that I need to read a little bit more about this particular definition with the ALICE stuff. And
Yeah,
especially,
and thank you for sharing this, because it reminded me that we should pull those data out again and have a deeper look, because there are significant number of ALICE households in Dunn County.
yeah, I think that was it, the household of 4, like $68,000 just to live. But the federal poverty level is like what, 20-some thousand for that, which is yeah, you can't have a house and provide for your family with that amount. So I'll share additional things, and UW Extension does a great job with their research and stuff. And there's a few things that our association is working with a few of their folks that are putting together basically trends, projections, because it's objective that the veteran population is decreasing in the state of Wisconsin, but the benefits and the number of claims are increasing significantly, and so that even the one correlation, it's sending a downward trend. You'd think it naturally, there'd be less to do. However, because of the vast number of benefits and the need, it's actually going up. So that's stuff that we'll be looking at, because it all comes down to objective numbers to support what we do. No additional questions, and I'll move to the financial part. So the financial documents, and it might sound like a broken record. Veterans Service Office has 3 cost centers: our operations, Soldiers and Sailors Relief Fund, and grant that we receive. The underneath our operations cost center, salary and fringe, and that's in attendance hours. Attendance hours equate to hourly staff, and the salary and wages equates to non-salary. So in Veterans Office, we got one hour or two hourly and one salaried staff. And everything is predefined in all of those particular categories. The areas that we have to strongly manage is the operating funds that come down to copy paper, things of that nature. And all of that, in that explanation, everything is well within, I would say, normal limits. No, I don't project any issues with that as we go forward here, kind of hitting the midpoint of the fiscal year. And given a quick overview of the veterans relief, that cost center, again, I don't see any concern or any issues. We have a number of other partners. We try to utilize that funding first. We're the funder of last resort. We have been using and tracking them based upon our CFO's requirements for gift cards, gas cards. So we're tracking that. So we've been utilizing those. We have a contract with Cenex on the north end of town. Works great, but when you're looking at time to call, confirm, send the veteran there, it is less time consuming to gas card, because there's a lot more local healthcare happening for our veterans, and that's what our requirement is. We will expand that out on a individual basis if somebody is looking for a job, or if they need to. I gave a gas card out the other day, individuals going to the Veterans Housing and Recovery Program. So we're using a little bit more of those for the transportation parts. The last cost center is our grant. Our grant total normally is $11,000. There's a supplemental grant that's now added into here, which is ARPA money. Some of the leftover COVID money came from the state. So total on that grant's $26,878. One of the grants, that funding ends at the end of the year, $11,000. The other $15,878 actually can use that through 2024, but our budget adjustments can only go for this fiscal year. I am planning on managing that out to keep hours pushing in to next year. However, I do have a request in, which I have a meeting tomorrow to talk about budget, because I requested a few more days in the office based upon county dollars going into next year, because grant money is going to dry up, the ARPA money. So I don't see any significant issues with any of the budget still at this time. Any questions about anything within the budget?
Any questions on either the detailed budget or the summary for Greg? Supervisor Hagan?
I don't have a question, but I have a comment. I was talking with a couple of community members this month, and one of them, she says her husband uses the VSO to transport him to the Twin Cities to get medical care. And so she had nothing like bad to say. She had like everything good to say. And she said Jessica's doing a wonderful job. So I just want to highlight that.
Yeah, good. Thank you.
Thank you,
We
Supervisor.
want to hear
Hagan.
that, but we're also open to suggestions on improvements.
Thank you.
Thanks.
Anything further? All right, as always, an excellent report, and you make us think, and we appreciate it. Before we move on, and just for the minutes and for did Supervisor Robinson sign in? She is, okay, fine. She wasn't.
I'm here.
Thank you, Supervisor Robinson. We didn't have her in when we called the roll, so,
No
okay.
problem.
All right. Moving along to public health. KT, are you ready?
Absolutely.
Thank you.
All right, guys. So in your packet, you have a typical update looking at some communicable disease things that you should be aware of, and some highlights from what the health department has been doing in the last month. Did want to absolutely share that we are working towards our strategic plan as far as our outreach goes, and we have been in a lot of different places. We've had some really good success with some employer fairs, getting the word out about what the health department does and who's eligible to use those things. We were at Phillips Medisize this week. We'll be at 3M in 2 weeks. So just kind of sharing that message in ways that we hadn't before, again, aligning with that strategic plan. So there's some information on that. Also sharing that I think we have 4 scheduled now, 2 completed, 2 upcoming Narcan trainings for folks that want to understand what are some signs and symptoms of addiction, what does a overdose look like, and how to use Narcan. And then there is Narcan that is free to us through the Narcan Direct program that is then distributed to folks if they, maybe you have a grandparent with a pain medication, you want to have it on hand. Maybe you have friends that use drugs. Again, it's a harm reduction technique, and we are trying to get that out to the community using a grant through the Northwoods Coalition. And then, of course, the Narcan itself is free to us through the Narcan Direct. So just sharing that. Also, let's see. Something that's really exciting is about 6 months ago, our WIC director highlighted that we have a gap in services around dental services. So many of our folks, or all of our folks on WIC are also Badger Care eligible. However, it's really difficult to get an appointment at Marshfield Clinic through our federally qualified healthcare center, dental center rather. And so a lot of folks were going without dental care. We were able to partner through an MOU with Bridging Brighter Smiles. There's no cost to us. We're giving them the ability to use our facilities during the same time we're having WIC clinic. So that incentivizes folks coming in for their normal WIC visits to get those heights and weights, as well as to do those that one-on-one counseling for those families. At the same time, they're getting some prophylactic dental care, both for pregnant women and for children 4 and younger. Really excited for that. That should start in September.
Cool.
Be good. Let's see. I did want to share just some context. So one of the things that I put in the packet was a grant requirement. So Nurse Family Partnership has moved from a predominantly levy funded program, evidence-based program, partnering obviously a nurse with new families, to more than 50% grant funded. So the largest funding for it is through a MICV, or Family Foundations grant through Wisconsin Human Services. I think that's who that's from. And they have some grant requirements. One of them was to do some objectives around equity. And so there's a larger project for the whole consortium, taking a deeper dive about racial experiences in the Chippewa Valley. And so that was there. The individual that completed that report works for the Eau Claire City County Health Department, but it was on behalf of the whole consortium, which again is a tri-county consortium. So just giving that feedback on where that's coming from. And then lastly, you do have a little synopsis about regulated facilities and the end of licensing year. And so I thought that I had actually intended to connect with you guys next month about some of the public comments that had come to us in June. I'm sorry, in July. But after hearing that we had the same public comment last night and tonight, and then an additional one as the one I received, I think it's identical to the one that Supervisor Hagan lifted up from a constituent on the 14th of July. I thought I would bring an overview of kind of what we know about our fees and where we have opportunity to improve. So when the state statewide gave those operations that went into different jurisdictions back to those jurisdictions, back to the agents, most of them were inappropriately licensed. They were licensed as a mobile unit. And in the regulation, a mobile unit is required to have a service base. So they take their cart and they go back to a place where they can dump their water and store their food and that kind of thing. Because DATCAP wasn't doing the inspections, most of those mobiles did not have service bases. And so what they actually were are transient. And it is a hard definitional thing to wrap your head around. But basically those transient are more like your food stalls at farmers markets and fairs. When we took that over, we did that first inspection, we did the assessment for safety, and then we did the risk assessment. All of our facilities have a risk assessment every year. Based on how they're operating, it puts them into that simple, moderate, or complex category, and there are fees associated with that. One of the things that we missed is that we don't have a simple, moderate, complex designation for our transient food vendors. And so if you have a food stall that's doing, fry bread tacos, that's the same license as eggs. There's a substantive difference in the risk. And so I think that this is something we really need to look at so that we can correct this issue. There's a little bit more in there. There's some information about the numbers. We had 7 mobiles come to us from the state. We have 4 that are in current status, and you've heard from 2 of them. So just helping you understand the how many people are impacted, but then also recognizing that we need to support our local producers. All right.
Do you want to touch on the community needs assessment in case people have
Yes.
missed their
Absolutely.
opportunity to reply online? I did.
Yes. And thank you so much for that. So in your packet, you also had the infographic with a draft watermark over it saying the community health needs assessment was set to go live on Monday, but because the packet went out the week before, it was still marked as draft. That has gone live. That link is available. Scan the QR code, go take the community health assessment. Again, it's looking at things that can impact health outcomes from a community perspective instead of a health department perspective, so that it can help inform our community health improvement plan. And it's only while we're leveraging staff in 3 counties, the data is only the Dunn County data, and the work will only be the focus on what Dunn County residents and or people who work here lift up as an issue. So thank you for that reminder. And then I do want to share, as far as COVID goes, we do expect that we'll probably have a fall bump, just like we have the last 2 falls. August, September, we've seen an increase, and just because of how people change in how they spend time together. We are starting to see more outbreaks. I've got one at a long-term care facility, one that was associated with quite a few deaths early on. And so that's hard to see that it's hitting the older population again, but we're also seeing more cases, and I expect that our wastewater data is going to show that increase next month. So just as a point of awareness, we are also waiting for ACIP, and I think I shared this before, to make their recommendations on a monovalent booster. Because we have a contract with the state for vaccines for children and vaccines for adults, we will be required through that contract to have COVID vaccinations when the booster is released. Again, it'll be free to us through that contract as well. All right, any questions on the update?
Oh, excuse me. Any questions for KT? All right, cool.
I'm
Oh,
sorry, I have a
Dr. Hall.
question. So I was really surprised to see we have had a bunch of Legionnaire cases. And have they gotten anywhere closer to figuring out the potential source at all?
Yeah, thank you for that question. It's actually Eau Claire County.
Yeah.
But we did receive the health alert at the same time. Providers and the media was alerted. I do understand that they have honed in on the source, but I'm not familiar with the particular case. I do know Legionnaires is something that's really challenging, because if you don't diagnose it and treat it very quickly, you can actually have deaths. And I remember
Yeah.
working one in Eau Claire from an environmental health standpoint where it was a 52-year-old female, no underlying health issues, smoker. You shouldn't die from that.
Yeah.
So I'm glad that they took it seriously and they worked through that. But yes, I think you guys should know about that. And it is mostly associated with breathing in water particles. And so it comes from American Legion conference in the, oh goodness, 70s or 80s, I think. And thank you so much. And it was associated with a water fountain. And so that's why it's named the way it is, but it's inhaling either from a cooling tower or a shower or a water attraction, contaminated water. And so there are some regulations around cooling towers in facilities. And of course, we follow up on all of these communicable diseases. Legionnaires is one of them that we follow up through WEDS. Does that help?
But that helps. It helps to know that they've perhaps identified the source, right? So that now they can fix it. So that's awesome.
Did I
Thank
get your
you.
question answered, Dr. Hall? Good. Okay. All right, KT.
All right, so looking at financials, two things that I want to point out. We are forecasting different spend out for our public health ARPA dollars because of the contract and what we've discussed about recovery towards birth to 3. So you have seen a reduction in what we're anticipating to end the year with. The other thing I will share is that our financial manager is on longer medical leave. And so our finance associate and I did our best. So if things look a little different next month, the expert is back in office and we'll talk through the differences and how KT can improve. Yes.
Yeah,
Yes.
another opportunity.
Yes. Any questions on the year to date?
Any questions on budget? Budget summary? No?
All right, thank you.
All right. Are we ready?
Yeah,
For human services, Paula has a nice written report
I do. And I just.
and we have a visitor.
Yeah, I just have a couple things I wanted to talk about that were not on the report, and then to highlight a couple things, and then Tracy's gonna come up and talk about the ADRC. I wanted to mention that we are having the county employee picnic on August 10th
Oh,
from
yeah.
2 to 6, and they are looking for some volunteers to help and be there. And so if you have any interest or willingness, please let me know, or Andrew at our county clerk know that
To
you'd
do
be
what?
interested in.
Flipping burgers?
Well, no, or like serving food or tickets, raffle tickets or different things.
What is the date again?
August 10th from 2 to
2
6.
to 6. It's here.
It's here.
It's here on the lawn.
And it's gonna be a lot of fun.
They always
We-
have been.
We have predicted like a pretty good number, like
Yeah.
350 people. Maybe.
Awesome.
And
We haven't, how long has it been since we've had a county picnic?
Last year.
Oh.
But there was not
Whatever.
nearly that number of people.
Whatever.
I think that's pretty fantastic. Some really neat things happening. So although I think it's because they have a really good planning committee too.
Of course.
No, just teasing. There's gonna be puppies. They're looking at a puppy rescue place coming in and having.
Are you kidding?
In a dump truck.
And a dump truck.
Oh,
So,
can I volunteer to take care of the puppies?
well, we'll see what they need. All right, so now on to other business. So if you do want to help, get a hold of Andrew. Then also I wanted to let you know that there's been issues with the software for the economic support program on the state side. And so there's challenges, people that are trying to get online to apply or make changes in their program. It's kicking them out. They're not able to do some things. And so the state is aware of it. They're working on it, but it has had some challenges. So if you hear that, just have people go back again, because sometimes they have to reboot the computer system and try it again. So making you aware of that if you hear it. And then I wanted to point out that in my report, if you didn't get a chance to read it, I talked about the foster care placements last time and the high number of placements that we have. But what I didn't talk about is that we have money in the other placement areas that are not being used. So then it ended up balancing and we even have additional dollars in there. So that was good news, taking a look
Yeah.
at that. And then you'll also see that Jessica gave me a graph of the number of calls coming into the call center, with the changes of the unwinding with the pandemic. So a snapshot here now, and then I think it's October, she's going to come in person and give you a more detailed
Yeah.
report when we have more data. So there is that. So beyond that, I wanted to invite Tracy up.
And then we have my.
So Tracy Fisher, she is the manager of our Aging and Disability Resource Center.
Oh.
Welcome, Tracy. Thank you for being here.
Paula asked me to present information tonight on ADRC and APS, the two areas that I supervise. Is there a way to make this so just one slide shows up, I wonder? I hope I didn't mess that up. Oh. There. Oh. Okay, so first, I think most of you probably know the basics of ADRC, but it stands for the Aging and Disability Resource Center of Dunn County. We're the access point for seniors and adults with disabilities, families and caregivers. We, for them to receive assistance, education, support regarding programs or questions they have, services they may need. We're the central point of intake. Each county in the state of Wisconsin is served by an ADRC. So they're, folks can see people in their own county for these types of services. Just very briefly, we in Dunn County, we are a combined ADRC and aging unit. So our ADRC provides information and assistance about program. We do the long-term care options counseling for people who are interested or eligible for family care or the IRIS program. Again, we're the single point of entry for if folks are interested in enrolling in one of those programs, they have to work with an ADRC for that. We have house our elder and disability benefit specialists in the ADRC. Dunn County is a little unique. We have the community health worker pilot project. We're one of only 3 counties in the state of Wisconsin that have that. That pilot specifically works with members of our Hmong community. And then we just recently got the ILSP, the Independent Living Support Pilot, which I'll outline a little bit more. And then our aging programs, that's our nutrition program, both congregate meals and Meals on Wheels, our transportation program that we work closely with transit to provide, our caregiver programs, and our dementia care specialist program. Those fall under aging, but again, in Dunn County, that's all under one umbrella. So the ILSP program is exciting, and I just wanted to give you, I think you've all heard about that a little bit through Paula, but I wanted to give you an update. For those of you who don't remember, the ILSP program stands for the Independent Living Support Pilot Project. We found out about that through BADER, which is the Bureau of Aging and Disability Resource Center. That's the agency at the state level that oversees ADRCs. Last fall, they provided information that there was a new program. They were interested. It would be administered through ADRCs or tribal ADRSs in the state of Wisconsin. They had a webinar for this program. There are 72 counties and 11 tribes in the state of Wisconsin, and there were, I think, 150 people registered for this webinar, individuals. And so we knew that the interest level was going to be very high for this program. But what the program provides is the state I really do have to give the state of Wisconsin a lot of credit because they went to bat with the federal government to be able to use some leftover ARPA money in a unique way. And what they requested is that they could use the funds, no longer needed or being used for COVID education type things, to utilize in this program. And what the program provides is throughout the state of Wisconsin, there are 5,000 enrollment slots for this program. If someone is enrolled in the program, they are provided up to $7,200 that can be utilized to keep them safely in their home. What's unique, it's similar to many of our programs in that it's our same ADRC clientele that that qualify for this. You can be 18, there's a little difference, 18 to 54 with a disability and a functional need. That's a little different in general. The rules for ADRC are 18 to 59 are considered a vulnerable adult, or 55 plus is considered an elder. And then you don't need to have a disability for this program. I know I'm close to being the elder age, so I don't know if I agree with that 55 age, but that's what qualifies you for this program. But 55 plus, you don't need to have a diagnosed disability, but you still need to have some sort of a functional need. What's very unique about this program, though, is really the financial eligibility requirements. The financial eligibility for this requirement is much more generous than our traditional long-term care programs in that people can have up to 300% of the federal poverty level. And I wrote down exactly what that is because folks usually ask me that question, but the federal 300% of the federal poverty level for an individual is $43,740. So they can, and that's income. Assets are not included in those calculations. So it's just annual income. So that opens up opportunities for a lot of folks that we see coming into the ADRC that we see have these needs, but they financially don't qualify for the program. And we know even if somebody doesn't financially qualify for the program, that doesn't mean that they feel or have money to spend $600 a month to provide, somebody to come in and help them take their showers or that sort of thing. So there's a huge gap in terms of, the state requirements for the traditional long-term care service programs and actually being able to fund those independently. So it was very exciting that this program was being put out there. We recognized that this was going to be a very competitive grant process. And because of that, I connected with the ADRC managers of Chippewa and Eau Claire County, and we decided to write a combined tri-county grant proposal. So we were, long story short, we were very excited that we were one of the 13 projects across the state of Wisconsin that was funded. So we found that out in, I think it was the end of January was when they made that announcement. We were very thrilled. The program was originally scheduled to go live or start fully on July 11th. We have hired our 2 staff members that will serve the 3-county area. They're program assistants. And we did find out right after I hired the folks that there's going to be a short delay in the official start of the program. There's a snafu with the state is developing a computer program system that will be the system that the financial administrator of the program, the third-party agency that will actually pay caregivers and that sort of thing. They're setting up a computer system for that third-party administrator to communicate with the state, and it's taking a bit longer. So they delayed the start of what they're calling now is we had a soft opening of the program, which was on Monday, the 24th. And so our 2 program assistants did start at the beginning of July. They've gone through all the training that the state has provided so far. And this week we started connecting with the folks that are already on our waiting list. All 3 counties, once we knew we were funded, we started keeping lists of people that we thought would be appropriate for this program, and have done some outreach with them to find out if they in fact are interested. just a little, also, we were granted 430 enrollment slots. So across the state of Wisconsin, Milwaukee got the most enrollment slots. Madison or Dane County was closely second, then Waukesha, and then our 3-county area got the 4th amount. So we were very, very pleased with that. And just numbers wise, because I'm proud of these numbers. So directly to consumers, if each consumer spends fully their $7,200 in our tri-county area, that will provide $3,096,000 of direct support. And then the funding that Dunn County will receive for the administration of the program is $371,520. So it's about $3.5 million total. The program is set to sunset March of 2025. So we are going to need to enroll all of our participants by March of 2024. And then those participants will have 1 calendar year to spend those funds down. The state has made it very clear that they're very interested in the results. There's lots of data collection that we'll be doing. Everything that they have said just make it sound like they're very, very interested in continuing the program if at all the funding could be provided. So we're really excited about it. Again, it's a big learning process and there's going to be some curveballs, but we couldn't be more excited that we were one of the funded projects. So very exciting stuff. And I think that it can really provide a lot of help for people that need it, but were simply excluded in the past because they didn't meet those financial guidelines. So very exciting stuff that way.
I did read the minutes of the ADRC advisory committee and noted that there was a specific compliment from the chair about how good our ADRC was. And so therefore was a recipient of this grant.
Well,
Nice.
I
I read
appreciate
it.
that comment. Yes. I hope that of course I think that's true, but I'm biased. So, but yep, I hope that is the case.
And I don't know if you've seen the news, but Tracy was on the news with this
Yes.
program. So that was pretty exciting
Yes.
too.
Well, it was exciting. It's way out of my comfort zone, but I was happy with how it ended up. I had about a 15-second little soundbite, and that's about all that I'm happy was on there. So yes, but and again, we will be doing more marketing of the program, but we're again, with this being kind of a soft launch and not being able to officially enroll people until that computer system is up and running. We will be pushing the program more, but maybe once everything is kind of set and ready to actually go. So exciting stuff. The next piece of information I just wanted to share is just talking about the other program that I supervise, which is our Adult Protective Services department. Basic roles of APS, we are charged with investigating any claims of abuse or neglect, financial, sexual, physical, emotional abuse or neglect against vulnerable adults. So again, 18 to 59 with a disability, or elders considered age 60 or up. Right now, we have 2 full-time staff members, Ashley Williams and Kelly Bean, both social workers that do all of the APS work, and then I supervise the program, but the bulk of the work is obviously with those 2 workers. Again, the types of cases that we handle are investigations. We refer folks for guardianship and work through the court process with our court counsel for those, and we do protective placements and services for folks that need that. One really positive thing that we got involved with APS last year, we have partnered with the Department of Justice for a grant. That it's actually a DOJ grant, but it's called the Elder Abuse Awareness Grant. The DOJ requested counties to participate. So in our region, it's La Crosse, Dunn, I believe it's Pierce County. And then there's some counties on the eastern side of the state that are participating, but the DOJ was funded, I think, about $2 million, and this is an educational program. So APS here in Dunn County, all of our local sheriff's office and Menominee Police Department are partnering, and Bridge to Hope. This is a combined project. Basically, there's 3 main arms of this grant. One is all police officers within the county of Dunn. So Boyceville, Colfax, Elk Mound, Menominee, and Dunn County will all, within this 3-year grant period, go through an 8-hour training about elder abuse, which all of those departments signed on to and really believed that they needed that sort of information. And our APS workers will be involved in all of that training with folks. That's one large part of that grant. A second part is this grant will provide funding that will most likely be housed with the Bridge to Hope, specifically for an elder abuse advocate. And then thirdly, another educational piece of that is we will be doing community trainings regarding elder abuse. A big focus of that is actually financial abuse, and we'll be reaching out to banks and that sort of thing. But again, Ashley and Kelly have agreed to become trainers. So they've taken on extra responsibilities. Right now, they've gone through the first part of the training process. Next month, they have the second part of the training process. Our DA is also being part of that team, the educational team. I always think it's funny because the DA, her training is in New Orleans. And that's being paid by the grant, and the old social workers, we got to go to Madison. So, it's kind of like one of those things. And the judges, actually the judiciary that's optional, but it sounds like they want to attend, and their training will be in San Diego. So, but again, there's nothing wrong with Madison, so we're happy with that too. But anyway, so that's an exciting thing. And all partners really agreed that the educational piece of how APS and law enforcement can work better together. We just had a case actually that Ashley was responding to where the officer said, I've been a 15-year veteran of the force and I've never worked with a guardian before. Well, I'm sure he has, he just wasn't aware of that. But again, just those educational pieces are so important. So I did want to point out that we have seen a definite rise in cases. I've included all the data I had. 2016, I think we can, they switched managers at the time, so I think the data collection may have been a bit different. But what I had from 2016 is that in that year, there were 86 APS referred investigations. Last year, 268. But again, you can see the trend is definitely increasing in terms of our numbers. I did see there was a little tiny decrease in 2022 and 2021. Or I'm sorry, 2020 and 2021. I do attribute a lot of that to COVID because we do get a decent amount of referrals from like physician's office, doctor's offices, and because people weren't going to those appointments, I think we missed out on some of those, and people just weren't going out and their families weren't connecting with them, that sort of thing. But between 2017 and 2022, there's a 43% increase in referred cases in APS. Somewhat even more concerning to me is I just looked at the first 6 months of 2022 versus the first 6 months of this year. And in just those first 6 months between those 2 years, we have a 48% increase from 122 referred cases in last year to 180 this year. So extrapolating, I mean, if referred cases continue, we will see an absolute astronomical jump in cases. So this is concerning to me because I just I see this trend continuing. I know I'm probably preaching to the choir here that you've all seen this, but I just included some data about the aging of the baby boom generation. I think we can just see that numbers are going to increase. In general, elders make up about 80% of the cases that are referred to us. We do have that 18 to 59-year-old, but that is the smaller percentage. Truly, elders are the bulk of our cases that are referred. So I don't think that this is a trend that's going to reverse or that we're going to see a downward trend in these numbers. And I only have 2 staff members to serve all of Dunn County. So I really do feel like we are truly at the breaking point that we really do need to ask for an additional staff member. And I know that is part of the DHS budget for this year, but I just wanted to kind of provide some of that justification as to why we're requesting that. Also, cases are just so much more complex, even in the time I will be here 2 years in November of 2021, but just in that 2-year period, I have seen so many more cases that we have had to partner with behavioral health to deal with. We've got co-occurring mental health issues of aging, like dementia, that sort of thing, AODA issues all occurring at the same time. And it's kind of like, who takes lead on this, because each of these issues is so time consuming and valid on its own, but we have folks that are needing that, needing services from all those areas. Again, the length of involvement, many of our cases are much longer. Our goal, once we open a case, really is to try to get it concluded within a 2-month period, and many don't happen that quickly at all, because they're just so complex. There's many factors. It takes longer to get through the guardianship process if that's the case. Paula asked me to kind of give a case example of one complex case. And so I have a couple notes here for this one case that started. It was a case where a home health agency made a report to us in February of 2022 of a gentleman they were working with, that they had a lot of concerns that he was no longer competent. He was not safe to be home alone. He needed a guardian. So our social worker went to first attempted to visit the individual on their own, but the individual was not answering the door. And APS, except in very limited circumstances, we are a voluntary program. We don't have the right to just enter in or, do those sorts of things. But she was able to connect with the home health nurse who this person knew, and had a scheduled time that they knew that this person would enter to do a visit in tandem with that person, so that they would be able to kind of gain access to the home and see what was going on. When they arrived, they found that the individual had a gas leak in their home that they did not recognize. And so truly it was an emergency situation. They called the fire department, they called the police, everybody, responded as they should. The person was taken to the hospital. Through my social worker's assessment, clearly this gentleman, he did not pass any of the cognitive screenings, even after clearing from this emergency situation with the gas leak. And she was very confident in the decision to move forward with guardianship. Our corp counsel was very committed to moving forward with the guardianship. We did move forward with the guardianship case. The individual did assert his full rights in the guardianship case. So he was assigned a guardian ad litem, which that would have always happened, but the guardian ad litem recommended that adversary counsel be advised for him, and it went to a full jury trial, which we unfortunately lost. So this gentleman was adjudicated by the court to be competent, and our case at that point, there was nowhere to go further with it, so it closed. Unfortunately, throughout this entire process, we continued to get numerous reports on this gentleman from neighbors, medical establishments, doctors, the police that were being called because of concerns about his health and safety, the condition of his home, his pets. So, and clearly we truly believe that this gentleman needed a guardian. So we agreed with all of these folks, but we lost this case. So technically this, by the time this went to court, it was September of 2022. So from February to September is where we got to the court process. Technically the case closed because there was a conclusion to that case, but we really have been involved. We continue to be involved, and we've officially reopened a case because there was a police report that came through that was concerning enough that corp counsel agrees it's again time that we should try to go forward with a court proceeding again to see if there's a different outcome. But again, this has taken substantial time for my staff. Many other agencies, including police, medical, he is enrolled in a family care program. They are trying to do everything that they can for him. But again, it's just a tough case. And these are the types of things that, we're seeing more and more are just these cases that, nope, they don't close within 60 days or 1 quarter. They're just ongoing and ongoing and ongoing. So that's just my case example of one example of a very tough case that has taken significant amounts of time. In order, kind of as a stopgap measure, I recognized shortly after I started in the position that this workload was not feasible for my 2 workers to continue. So I did reassign what are called Watts reviews. You may not be familiar with that, but when somebody is under a guardianship and under a protective placement, we have to provide a yearly report to the court about how that protective placement is going. And so I did reassign that work to some of my other ADRC workers. It's not ideal because the original social worker that performed the guardianship knows the situation, knows the person, oftentimes has built a bond and that sort of thing. So ideally that Watts work is with the original APS worker, but there had to be, something had to give is essentially what happened. So I already have some of their work reassigned and, you know, APS is being billed for that time separately through my other ADRC workers. But truly best practice would be for that work to stay with the original social worker. And it gets a little bit messy because guardians and guardian ad litems and all that sort of thing are understand and connect with that original worker that they worked with. So there's communications that instead of going to the worker that's writing the report or going to the original social worker, and it's just not as clean as I would like it to be, but it was just meant to be a temporary system that would at least help in the meantime, basically. So again, for all of those reasons, that's really why we're advocating for that additional staff person at this time in the APS area. So, and that is all that I really had for my presentation today.
Okay, thank you for that.
Yes.
Go ahead, Paula.
Yep, I just wanted to remind the committee or the board that APS is one area that we had on the legislative agenda, and it didn't make much progress in there. Small amount of money, I think, was approved for the entire state, but nothing that is going to bring any funding here and enough to do anything with, and it's almost all tax levy in that program. So
I did just print off copies for you folks just of those charts that I provided. So if it's all right, I'll just distribute those so that you have those just to refer back to if you'd like, but.
Perfect. Thank you very much.
and then the financial report.
Yeah, please.
And so you have that in front of you tonight. We are through the end of June in our projections. And so you can see here that our net figure here is $547,880 to the good, more revenue than we have projected expenses. So hopefully that will continue. I know that when Jerry and I went through the funding for this month, there were several very large Medicaid payments that had come in to help support this funding, you know, where we are currently. So that was a nice bump this month. But as you know, they kind of randomly come in, but that's, you know, one of the things that we're going on here with the methodology and the projections. So I don't know if you have any questions with that, but right now we're sitting okay.
Yeah, looks good. Any
Okay.
questions for Ms. Winter about the budget projections? All right, well done. All right, we have a couple of items of business to take care of. We have the June DHS budget vouchers. Hopefully, with Cassie's suggestion, you found it easier to scroll through them. Hopefully not to print them. But the bottom line this month, and again, this is our checkbook. This is sort of normal business that we conduct every month. The bottom line is $327,765.25. We don't approve these. We note review of the DHS vouchers, and I would like a motion to do that. Mr. Lamb moves. Is there a second? Supervisor Hagan seconds. Any discussion? Questions? Comments? Concerns? All right. If not, all in favor signify by saying aye.
Aye.
Any opposed? All right, the DHS vouchers for June are noted. And finally, we have a really big budget adjustment. And I think just for the sake of some clarity, I'm going to turn this over to Paula.
Sure, I met with Jerry on this again. It is cleaning up a lot of grants and she said, beware, there's gonna be another one next month that's gonna have additional on there, but it's, you
Lots
know,
of grants.
you project at this time of the year for what's gonna happen next year, and we're actually just getting the state county grant information and contracts through, and it's cleaning them up. So that's what it's all about.
All right. Seems pretty reasonable to me. That it just is a longer list than we're sometimes accustomed to looking at. Any questions about this? All right, I need a motion to approve the DHS vouchers, or excuse me, budget adjustments. Is there a motion?
Motion.
Supervisor Hagan, is there a second?
I'll second.
Ms. Rudy seconds. Any additional discussion? If not, all in favor, say aye.
Aye.
Any opposed? Motion, a budget adjustment is approved. And that is all we have. Except that it is Supervisor Hagan's birthday. And there is a birthday cake. Back there, there is a gluten-free treat also. So please stick around and have cake. And I wish we could offer cake to our colleagues on Zoom and our people checking in on the county YouTube page, but we will enjoy the cake. And thank you, everybody. Without objection, we are adjourned.
Have a good night,
Thanks,
everyone.
everybody. Good
Bye,
night.
everybody.
Happy birthday.
Thank you.
Happy birthday.